uninsured number here. So basically what he said, since the ACA was passed about halfway cut in the number of uninsured. So cut in half, I should say. It's a better way of saying it. So we're grateful for that reminder. One of the things I want to do today, in addition to talking about why we should not repeal the Affordable Care Act, is to talk about the successes of this legislation. Sometimes we need a little reminder of that for some folks in Washington, but I'm hoping that these days are the kind of days when we can be reminded about the benefits of the Affordable Care Act. So I'm grateful you're here. I won't keep you long, but you'll pardon me if I get into a strong argument here because I feel passionately about this. But grateful to have the Commissioner, the Executive, and Representative here with us, and everyone else who's here to talk about this issue. I know we'll be having a roundtable in just a few minutes. And I do want to thank those who will come after me to the podium to talk about their own lives. Let me just say it bluntly. Repealing the Affordable Care Act is a bad idea. It was a bad idea years ago. It was a bad idea a week ago. It's a bad idea today. And it's a bad idea whenever those in Congress who want to repeal it get to it. It is dead wrong for the United States of America. We know the consequences of repeal are almost unthinkable. And we should remind ourselves that the people who are voting on this in the House and the Senate to repeal, they have health care. Members of Congress and their families have health care. You know what they have to do to repeal this? It's a very strenuous exercise. They have to put their hand up and just go like this and say no. Okay? That's all they have to do. They don't lose their health care. Their families don't lose their health care. But a lot of people will. By one estimate, 30 million Americans will lose their health care with repeal. I'll give you another number, 20. 20 million people got health care under the Affordable Care Act. And if they repeal it, there's another 20. Premiums will go up by 20%. So if we remember no other numbers but 30 and 20, all three of them are compelling. 30 million people will lose it. We know that 20 received it, and we know that premiums will go up by 20. Here's another number for Pennsylvania, 956. 956,000 people in this state have health care because of this legislation. People that had health care long before the Affordable Care Act was passed have better protections because of this law. Well, there's a lot of talk about issues that relate to the exchanges, and I am willing to talk to anyone about those. I'm not one who says this is perfect legislation. But what I will not be part of is an effort to repeal something that is working for a lot of people, that has saved a lot of lives, has prevented people from dying in Pennsylvania and across America. And that is an understatement. That is an understatement, not an overstatement. So I'm going to fight like hell against anyone who's trying to repeal this law. If they want to talk down the road about trying to make changes, maybe we'll do that. But when someone comes in the door and says, I want to repeal this, but I want to talk to you about it, I say no. We're going to fight you on this. We're going to fight you today, tomorrow, next week, next month, next year. However long it is. This is about real life. Human lives are at stake here. It's not about some Washington debate, about some healthcare theory or some policy. This is about whether people are going to live or whether they're going to die. And the people voting on this don't lose anything when they're exercising their right to vote as a member of Congress. Well, let me talk for a minute just about the benefits, because maybe the only upside to this debate so far is that people are being reminded about the benefits. 20 million people got health care in the United States of America. Almost, as I said, 1 million here in Pennsylvania. How about 11 million seniors across the country saved $23 billion, that's with a B, $billion, by closing what is benignly called the donut hole. We should call it the burning a hole in your pocket prescription drug costs. So what is that $23 billion dollars saved by 11 million seniors. What does that mean? It means about $2,000 per senior because of that remedy alone. You repeal the Affordable Care Act and seniors are paying more for prescription drugs. Okay, it's as simple as that. In Pennsylvania, that $23 billion national savings was about $1.3 billion. So Mr. Legislator, Mr. Senator, Mr. Congressman, when you go to vote to repeal the Affordable Care Act, you got to look those seniors in the eye and tell them why it's good for 11 million seniors not to get the help of prescription drug coverage. How about this number? 125,000 fewer patient deaths in the United States of America due to complications like falls and infections. And that's only over a 5-year period. More than a 20% drop. 125,000 fewer deaths because of this legislation. And this is the fourth, and I'll end with this. Uncompensated care reduced in the United States of America by $7.5 billion, and in Pennsylvania by $680 million. So you got to tell those hospitals what you're going to do to fill that gap. When you destroy the Medicaid program, for example, by virtue of repeal, or by virtue of that extreme right-wing Republican budget that members of Congress have been trying to jam down our throats for years. They've been passing those extreme budgets for years. But we had a president who vetoed those budgets and Democrats who fought against it. But that's the reality for Medicaid. And you know what? We need a little reminder about Medicaid, how important it is. Medicaid, if we had the right name for it, wouldn't be called Medicaid. It would be called the Senior Citizens Baby and Disability Program. That's what it would be called. Because they're the three groups of Americans get help. A lot of poor children, 45% of all the births in the country are paid for by Medicaid, 45%. So if you say you care about families and babies, how do you gut the Medicaid program? Answer me that, Mr. Republican member of Congress. It helps folks with disabilities all across the country, and 60% of the nursing home placements in the United States of America are paid for by Medicaid. So what are you going to say to a middle-class family? Sorry, our right-wing ideology meant that I had to cut your Medicaid budget so you can't get your mom into a nursing home. What do you say to that middle-class family? What do you say to that poor family where a child is getting good quality health care through Medicaid? What do you say to those families? I guess they say that their right-wing ideology was more important than children across the country. So we're going to have a big debate just about Medicaid, and we're going to fight like hell against those kinds of cuts. I could go on, but I won't, because I think you get the picture. This is a bad idea. This is an idea that started, I guess, in some right-wing think tank, that this is a good idea to rip away health care for people that have it, for kids, for seniors, and for the middle class. And oh, by the way, you know who gets a big tax break from this? If you repeal the ACA, you know who gets a big tax break? Millionaires and up. So put your hand up if you're worth over $1 million, okay? I can't put my hand up, but I hope
Does wishing count?
$1 million, because you're going to get a tax break if they're successful with this repeal. Let me end with just one thought. This isn't about a Democrat versus Republican fight. There are a lot of Democrats and Republicans in rural communities in Pennsylvania that will be adversely impacted when a hospital closes. Because we're going to have a lot of hospital closings if they do what they're trying to do to the federal budget and to the Affordable Care Act. There'll be a lot of Americans who have protections now who aren't in the exchanges, who aren't in the roughly 10 million in the exchanges, which gets all the media attention. What about the 150 million Americans who have better health care through their employer, but they may not know it, but it's because of the Affordable Care Act? Pre-existing conditions, for example. We lived in a country for so many years where we allowed an insurance company to say, I know your child is sick. I know you have an insurance policy. I know you're paying your premiums, but sorry, we can't pay for your child's treatment or coverage because that child has a pre-existing condition. We wiped that away, and they apparently want to bring it back. They want to deny children coverage and treatment for a pre-existing condition. That's an abomination. That's an insult to every American. I don't care where you live or what party you're in. We should never allow that to happen again. So it's another reason to fight like hell against repeal. I was going to end with this, and I jumped ahead of myself, or went backwards, I guess. But here's a thought. I know people will say this is a big partisan debate. Well, let me read you some words from a woman who happens to be both a Republican and a dairy farmer, okay? She's not some Democrat who came out of Washington talking about health care. Here's what she said about her life. A Republican dairy farmer from Pennsylvania. Just met her yesterday. But here's part of her letter. She said, "The Affordable Care Act allowed my husband to join me on the dairy farm where I worked for 8 years and am co-owner of the land. Over the past 3 years, we've straightened out our finances. We got our student loan debt under control. That's one good result from getting health care coverage. We opened up an IRA to plan for our retirement. Another good thing to do if you have health care, if you can make that work." Then she goes on to say, "We live in a small trailer, own one car, shop at discount grocery stores and local Mennonite food stands. We've worked hard for financial stability. Over the past year, we've begun discussions about having a child and starting our own business. Threats to the ACA are threats to our future." And then she addresses me, Senator, "and threats to the future of small businesses, agriculture, and families." And she goes on with the letter from there. So if you're voting for repeal, you've got to give her an answer. You've got to give her an answer as to why that repeal is good for her and her husband and their hopes for a family and their dairy farm and all the problems they've been able to begin to get under control because they have health care. So I hope that our Republican friends in Congress have an answer for her. You know what, the biggest question I have for them is, where is this great repeal, or where is this great replacement program? This whiz-bang program that's going to be perfect for everybody. They're going to rip away health care from everybody, but then they're going to replace it with something much better. If you hired a private investigator to go throughout Washington to scour every office, every corner of every office, you will not find a replacement plan. I don't care how good that private investigator is, because there is no replacement plan. And they know there's no replacement plan that they can come up with that will be better than what we have now, imperfect though it is. And I'm the first one to admit that. But they have some answers. They should give the American people some answers to some basic questions like that. So we have a long, long fight ahead of us. And I'm ready to fight as long as it takes. First, to prevent repeal, and then I hope someday to get to work fixing what needs to be fixed. But repeal is not the answer for what ails America. We should be working together to make our healthcare system better, not to destroy it by way of repeal. So I'm grateful for this opportunity to be with you, grateful to have the chance to listen to those who are going to give us testimony at the roundtable. It's great to be back in the Lehigh Valley. Thanks very much.
I'm going to now ask for Mr. Brian Klein to come speak. Mr. Klein is a consumer who has benefited from the ACA and would like to share some of his story.
Thank you. Thank you to the Neighborhood Health Center of Lehigh Valley for hosting this event, and thank you to Senator Casey for your steadfast commitment to the Affordable Care Act. So I don't exactly have all the numbers, but I have a story to share. For 9 years, since I left a job in 2006 when I had health insurance, for 9 years I had no health insurance. I had to rely on free clinics to get my health care. And you know, it was kind of substandard, to be honest with you. But then, thank God, in early 2015, when Governor Wolf decided to accept expanded Medicaid funding, I finally became eligible for the Affordable Care Act under Medicaid. And thank God, that happened because in January 2016, I was diagnosed with stage 3 colon cancer. So my life was turned upside down. I had the surgery to remove the tumor from my colon, but then of course I had to go through 6 months of chemotherapy too. So from March till September, I was going through chemotherapy. I'm still ongoing cancer treatment. I mean, I had a recent CAT scan that showed that there's no evidence of disease right now. However, for the next 5 years, I will still be under surveillance, which means I'll be having more doctor visits, more CAT scans, more colonoscopies, and of course more blood tests. And that adds up. That's money in which, I can't afford to pay that. I work a part-time job at a big box home improvement store. I make $11.66 an hour, okay? So my choice was like, and like a lot of millions of Americans, before the ACA, it's like, okay, you're diagnosed with stage 3 colon cancer. What do? Well, you have 2 choices really. You pay for out-of-pocket, perhaps face medical bankruptcy, or you do nothing and you eventually go to stage 4 colon cancer, which the rate of survival then is pretty low. So it was absolutely scary for me. I get emotional about this. It is not easy just like reading in the news and the media about what the Republicans want to do to so many millions of Americans. 20 million Americans are now benefiting from the ACA. And they want to take that away from me and my fellow Americans. It's like, what am I going to do? What am I going to do without my Medicaid funding? Like I said, I will still be going to doctor visits like for the next 5 years. How am I going to pay for that? So it's really astounding. I don't have an exact figure, but my medical costs are probably, it's probably north of at least $100,000 at this point. And who knows hopefully by the time, once I'm finally, declared cancer free within 5 years, what the total cost will be. I don't know. But I certainly can't afford that out of pocket. Here in Pennsylvania, Senator Casey said 956,000 Pennsylvanians have benefited from the ACA. And it's just appalling that the Republicans in Congress and Senate just want to rip this away from us. So that's my story, and thank you so much for letting me share my story. And I guess we'll move on to the program.
I'm going to introduce Antoinette Krause, Executive Director of the Pennsylvania Health Access Network, which is a great advocacy network that has been working with us tirelessly for the last few years to help reach out and assist individuals with enrollment.
Thank you, Senator Casey, for being a champion for working Pennsylvanians. Thank you, Melissa, and the neighborhood health centers of Lehigh Valley for all the work you guys have done, being on the front lines, making sure people can access quality, affordable health care. The Pennsylvania Health Access Network, we are a statewide advocacy organization. We have been on the front lines for the past 8 years, bringing the consumer voice to policy discussions in Washington and Harrisburg. We also are a navigator organization, and in the past 3 years, we've enrolled over 6,500 individuals in Medicaid, CHIP, and the marketplace. So our staff is on the front line every day, working with individuals who have benefited from the Affordable Care Act. We work with folks that are Democrats, Republicans, independents, folks from rural parts of the state, urban parts of the state, young adults, small business owners, cancer survivors, healthy individuals, folks with pre-existing conditions. And one thing remains true for all of these folks. When we look them in the eye, we now see the relief that having access to affordable health care coverage has for these folks. The relief that comes from being able to know that they can no longer be one accident or illness away from financial disaster. I think we've thrown a lot of stats out today, but there are folks like Brian and other folks all across the state that depend on this for their life. You know, we talk about almost 1 million Pennsylvanians have benefited from being able to access coverage. Half of all Pennsylvanians have a pre-existing condition. That's half. So you're looking at a huge population in Pennsylvania. Those folks now are protected from being one accident or illness away from being denied health insurance coverage. And Republicans in Congress want to take that away. We also want to talk about the economics. The Affordable Care Act has brought $34 billion into Pennsylvania in tax credits to make health insurance affordable, to health centers like the neighborhood health centers of Lehigh Valley to serve its clients, to build infrastructure. It's going to our rural hospitals, you know, to help treat the uninsured. So, you know, not only are lives at stake, but our economy's at stake. We all see the headlines at Harrisburg, the budget numbers. You know, how are we going to fill that gap? By repealing the Affordable Care Act, we will lose hundreds of millions of dollars in the state budget. So lives and our financial stake are on the line. This is also a personal fight for me. You know, when we talk about all of Pennsylvanians have, or half of Pennsylvanians have a pre-existing condition, I grew up with a mother who has epilepsy. Not her fault. You know, as a child, she was diagnosed with it. Doctors, you know, don't know how it happened. They think she fell off a slide, might have hit her head, but, you know, she struggled getting health insurance coverage her whole entire life. She met my dad. You know, my dad worked hard his whole entire life, 25 years at the same business. And she finally was able to get health insurance coverage and that peace of mind. You know, my dad worked hard. He put, you know, a daughter through college. My sister, you know, enrolled with the United States Marines to serve her country. And, you know, 5 years ago, my dad reached retirement age and he said, you know, it's time to retire. I want to spend more time with my family. Well, he had to delay that decision because no insurance company would cover my mom. Without medication to sustain her seizure, she could have a grand mal seizure and die. So he delayed his retirement, and finally, thanks to the Affordable Care Act, my mom was able to get coverage, and she no longer had to be scared about having a pre-existing condition. Now both of my parents are Medicare age and rely on that program. So, you know, that's also a vital program we need to protect. And, you know, my mother benefits from provisions, the donut hole. Her medicine's expensive, and they reach the donut hole every year. And thanks to the Affordable Care Act, that's closing. So while members of Congress are debating this, I want to ask them, what happens to my family? What happens to Brian? What happens to all the folks in this room that rely on the Affordable Care Act? So we thank Senator Casey for standing up and protecting Pennsylvania families, and we're going to fight like hell to make sure that we don't have benefits taken away from us, and we need to make sure that, you know, we can't wait years for a replacement plan. So what is the plan? If you're going to repeal the Affordable Care Act, what are you going to replace it with? So thank you everyone for coming, and thank you to the folks that are sharing their stories.